Hi, I'm Chris Vest, the Director of Public Policy at ASAE. Healthcare reform is dominating the legislative agenda in Congress this summer, and associations have a huge stake in this issue. Here to talk with us about healthcare is Steve Anderson, the President and CEO of the National Association of Chain Drugstores. Steve, from your perspective as an association professional, what are the one or two biggest issues that Congress really has to address as they look at healthcare?
Well, this healthcare package that we are debating and probably will for months, if not years, is extraordinarily complicated and complex. There are a lot of different parts of and pieces of it, a lot of moving parts. And the interesting thing is that as they've considered this, they've talked about options, but now, and as we go forward, they're really going to be looking at the specifics. I think the biggest issue they'll have is how they are going to pay for this healthcare delivery system.
Financing does seem tricky right now. Associations, they have such a diversity of opinion in their membership, expertise. How do you get these members who know so much about this issue in front of Congress and talking to the people who are really going to be looking at healthcare reform?
Well, one thing we're really focusing on is tapping into the resources that we have, not only within our membership, but also on our staff. We deal with a lot of complicated issues that deal with reimbursement, how our members are reimbursed by the government for the services and products that they provide. And as a result, those really are our best spokespeople. We go to the Hill on a regular basis, and we are attempting to use fly-ins and other methods, because really that's what members of Congress really want to see. And we've reached consensus pretty easily on our big 2 or 3 items that we'd like to see in healthcare.
Sure.
And now we are, spreading that word on the Capitol Hill, I think, with really a very united voice.
Well, I know you have a great message to share. There are a lot of ideas on the table. What do you honestly think that the healthcare system in this country will look like 2 years from now? Fundamentally different, or a similar system, but with some important revisions, modifications?
I think healthcare is going to look different as we move forward in the future, and it'll be interesting to see how the current debate resolves itself. After the Clintons' healthcare plan failed, there was a series of incremental healthcare delivery steps like S-CHIP, which had to do with children's healthcare coverage and those type of measures.
Right.
I said a year ago that I thought it might be probably more beneficial and more successful if we divided up the big healthcare bill into about 4 or 5 easily digestible pieces where members of Congress could fully understand the impact that they could have, and the American people could be brought along accordingly. It'll be interesting to see that, depending on what ultimately happens with this healthcare bill that is pending in Congress, whether we will fall back into that more fragmented approach, or whether we will have a very dramatic and fundamental shift in 1/7 of our economy. I think that'll be in smaller pieces ultimately.
Steve, you put a lot of interesting ideas on the table for us to consider. Thank you so much for your time, and tune in to thepowerofaid.org to learn more about healthcare reform this summer. Thank you.